Aphasia by Brielle Fordyce. Can you list as much information that you know about aphasia? We'll take about 1 or 2 minutes to do this. Independent problems that coexist with aphasia. Apraxia of speech is a neurogenic speech disorder. They have difficulty with the motor planning of speech, impairment in the capacity to program the position and the sequencing of muscle movements for the volitional production of phonemes. There is no significant weakness, slowness, or incoordination in automatic speech. Dysarthria is also a neurogenic speech disorder. It's caused by muscular weakness. It affects respiration, phonation, articulation, resonance, and features of speech. Speech characteristics. Abnormally excessive nasal speech quality, imprecise articulation behaviors such as slurred sound productions and periods of speech unintelligibly, slow labored rate of speech, stained or strangled voice quality, limited vocal pitch and loudness range and control, uncoordinated, shallow, forced, uncontrolled, and overall disruptive speech breathing pattern. Assessment of aphasia. Where to begin? Assess those that create functional difficulties for the patient and family. What are most prominent characteristics of the aphasia and what are the less prominent characteristics? You should review the case history. Consider assessment as ongoing. Use client-specific measures and select tests that will assess the most relevant skills in the briefest way. The assessment should be extended, systematic, reliable, valid, and client-specific, flexible. Diagnostic tests. They should be comprehensive. They may take several hours to administer. They assess several language functions in depth. They are standardized and they provide sufficient information to plan treatment. Some examples are the Western Aphasia Battery and the Boston Diagnostic Aphasia Examination. Most frequently assessed behaviors: frequency of speech, syntactic and morphological features, conversational speech sample, auditory comprehension skills, repetition skills, naming skills, speech production, writing, reading and reading comprehension, automatic speech, and nonverbal communication. Screening tests. They help to make quick initial assessments. They're about 10 to 20 minutes to assess. They sample only a few language functions. They are formal or informal tests. They do not provide enough information to plan treatment. Some examples are the Boston Diagnostic Aphasia Examination short form. Patients' language abilities are evaluated through only one modality. It's an in-depth assessment, sensitive to even mild impairments, auditory comprehension test for sentences. There's a Boston naming test. There's a reading comprehension battery for aphasia, and then there is a token test. Functional assessment tools. They target communication assessment in natural settings. They often require systematic observations of the patient's social interactions in everyday situations. They are not always standardized. They are very helpful in planning treatment outcomes. Example is the communication abilities of daily living. A Test of Functional Communication. It's by Audrey Holland, 1980. Second edition, 1999. Audrey Holland, Cara Fortilli, and David Fromm. It's designed to examine how a patient might handle life activities. The patient engages in role playing in a series of stimulated situations. The testing time is usually 30 minutes to 50 items. Can you please make one last question for me and ask your neighbor to the right of you? Thank you.